Hi, John at Town & Country Compounding here in Ramsey, New Jersey. I wanted to talk today about a treatment that's often used for ear infections. It's actually what's called an Otic Insufflator. And this prescription here, and there's different ones, actually contains 3 different medications: amphotericin, chloramphenicol, and sulfacetamide. And with ear infections, often ear drops are in a liquid. And when you have a infection, particularly if it's like fungal, which a lot of ear infections are because of people wearing hearing aids, people wearing earbuds and things like that, it will kind of cause that, that dark moisture to stick there, and then you can get the fungal infection. So as opposed to an ear drop or an eye drop used in the ear in a liquid state, that liquid is not good if it's a fungal infection. So there's what's called an Otic Insufflator, and in which case the prescription that your prescriber prescribed for you is actually a dry powder that you puff in the ear. And many of the patients, although it's easy to follow the directions because it just says 1 puff with insufflator twice daily, easy to use, but they have trouble using the insufflator. So it's really just a little, as you can see, a little squeeze bulb, and it has a tip that goes in the ear canal, and the tip comes off. And the part that confuses people is you have to take the capsule out of your prescription bottle, and you take one of the capsules. And what you're going to do, with any capsule, there's a smaller and like an overcap, a smaller piece to the capsule shell. You're going to actually remove the top so that you're opening to expose the powder in there. You can see the top just came off, and then I'm going to discard that. And then the confusing thing is, if I turn it over right now, some of the powder may fall out. But this is going to help to blow the powder into the ear. Most people think that you put the open side down in, but that's the wrong way. What you do is you just drop it in with the open side up. And the cap just drops down there. And then you put the tip back on. And again, following the instructions on your prescription vial, in this case, 1 puff twice a day, you would take this, insert it into the ear canal, and then puff. And you can see, I don't know if you'll see it here on this video, but you can see that puff come out. So, that's why most people think that they have to have the open side in, but it's the other way. Now, you don't take the cap out because, the cap will give multiple puffs. What we recommend is that you take the cap and take like a drinking glass, or if you have small children in the house, we can supply a bigger prescription vial with a safety cap, and you put this in there and leave it standing up. That way, each time you're going to use it, you would just, take it out and again insert it into the ear canal and give that puff. And that's how you use the Otic Insufflator.